Hello and welcome to Health Professional Radio this afternoon. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio today is Dr. Brad Hesse and Dr. David Ahern, co-authors of the book Oncology Informatics, Using Health Information Technology to Improve Processes and Outcomes in Cancer. Welcome to the program today.
Thank you.
Thank you both for coming back. What is Oncology Informatics?
I think that in its simplest form, it really is a matter of taking advantage of the best information technology and communication technology that we have available and applying it to clinical care for oncology for cancer patients. Mm-hmm. So that's what we think of as being this compendium of articles about how to use that kind of communication and health information technology to improve oncology care.
Now, have you always been involved in oncology and cancer research and treatment?
I'll start from my end, and I'll let David complement that a little bit. But in some ways, I've been involved with informatics and healthcare and how it intersects with technology. I have been involved in that since about the 1984 or so, when it was very first starting as a field. I'm a psychologist by training. But I was in a place where we were starting to use personal computers to help physicians as they made very tough diagnostic decisions. And then I went on to study how people use computers to talk to each other, which in 1984 not many people did. But not long after that, the internet became very popular. Then in 1993, the web became very popular, and it just has accelerated what we can do with that. National Cancer Institute reached out to me in 2003, and I've been with cancer very specifically since 2003 now, trying to bring those lessons in that we picked up in the decades before into the world of oncology care.
And David?
Yeah, and Neal, my career path is in a number of ways similar to Brad's, in that I'm really a behavioral scientist and informaticist, where I'm interested in the role of behavior and health, and where technology can enable our understanding of the relationship of behavior to health. And that's been sort of the career focus. So I've really focused not solely on cancer, I've focused on a range of medical conditions. And my career has taken me to academic medical centers. So I'm at the Brigham and Women's Hospital and Harvard Medical School is my home base. And I do a good bit of work in the informatics world for healthcare more generally, not only cancer. But in the last 4 years or so, I've focused with Brad on the challenges we've discussed around cancer and cancer care and the opportunities that informatics can bring to addressing those challenges, and that's been my focus in the last several years.
Now, you both are involved in the President Barack Obama's initiative, the Moonshot initiative. Can you talk about that initiative, how it ties in with this new information sharing revolution?
Sure, and I will. I'll contextualize that a little bit in saying that I'm not directly involved in as much that the vice president's reached out to a lot of us across the National Cancer Program, anyone who can make a contribution to accelerating our pace in cancer to do in 5 years what we'd otherwise do in 10. We all share that responsibility. So I haven't been involved directly with the vice president or the blue ribbon panels that are advising him, but I certainly by extension have been involved with the National Cancer Institute in thinking through all of the issues that we can now collectively move toward. Many of those issues, the first thing that we figured out as a group talking about this, some of the first issues have to do with sharing data. If we want to really learn more quickly, then we have to learn from the willingness of patients who are going to give us their data, and that might be happening in one part of the world or one part of the country, and be able to share that with the genomics experts in a lab on the other side of the world or the other side of the country, so that we can learn very quickly how to tailor our treatments and find new possible targets in a very precise way to help other folks reach a resolution to their particular disease as well. So we see that sharing data and then speeding up the implementation by which current knowledge gets into the hands of practicing clinicians, that's key, I think, to the Moonshot.
So we're steadily, not overnight, but repairing a fragmented system of information sharing. How does the patient benefit not only from the care, but the cost of repairing this fragmented system? Is it going to is this new technology going to somehow pay for itself just in being, much more efficient, or are we going to see some of the trickle down to the patient?
Neal, that's a great question. And I think if we really had an answer to that, we'd probably be having a direct line to the vice president's office today. It's a major challenge around cost. And I've learned in my years of working in healthcare that very little we do ever reduces costs. It seems to add costs. But I think this may be an exception that it in many other industries, if we look at banking or finance, air travel, and so on, enormous efficiencies have reduced costs, and we've seen that end up at the consumer level. And I think that there's that potential for greater efficiencies to reduce costs ultimately to the consumer or to the patient. But it is incredibly complex, a complex system. And we'll have to, carefully monitor how these changes, what impacts they have, and make sure that we adjust them accordingly so that they don't substantially increase costs, but rather reduce costs. Because I agree with you, that's an area really of importance. I did want to mention, just with respect to the Moonshot, because it is sort of important, that the book was published in March of this year, Oncology Informatics. And we really had been working on the book for 2 years. So in some ways it was fortuitous that the Cancer Moonshot announcement this year just happened to dovetail with the release of the book. But the work that the book addresses is so pertinent, as Brad has indicated, to the Cancer Moonshot in a number of ways in terms of facilitating not only data sharing, but also the role for patients in not only the data sharing between providers and health systems and oncology practices and so on, but the ability of patients to donate their data is another very big part of this, which is really quite revolutionary in the history of research, certainly in cancer, if not in other areas, where patients have been largely passive recipients. They are, engaged in trials, but often not so much a participant, an active participant. And that's really something that we think can change and needs to change, so that patients have a much greater role to play at a number of levels in the research going forward. And the informatics tools and resources for the patients, those tools, whether they're smartphones and apps and sensors, are really going to be instrumental in helping us better understand the problem of cancer and the response to treatments to cancer. So there's some really great promise here in this changing landscape we're looking at.
Do you see a difference in what patient privacy means to the patient, as you say, our willingness as patients to give our information, and what patient privacy means to the caregiver, the person who's responsible for this information? And do you see a bridging of that gap between our willingness to give up information and all of this brand new sharing of information? How do you address that in the book?
And that's a very sensitive topic, as you can imagine. So I'm glad you brought that up. And it has to do, I think, with the confidence that people have in how well their data are being kept confident and being used for the purposes in which they were intended. So I know that we often hear from patients that they've donated their data to a research study, but then there are anxieties on the caregiver's side, largely because of the Health Insurance Portability Act from several years ago, HIPAA, where people are very concerned about the privacy rule in that, and then may not share the data. And then the patients will get back to us and say, why didn't they? We gave that data for a reason. We gave it because we wanted it to be used. So what we're looking at, and what we talk about a little bit in the book, is we talk about some of the broad experiments that are patient-originated. Patients Like Me, for example, there's a chapter in there from authors of Patients Like Me where patients very willingly give up their data so the pharmaceutical companies can mine it. And they're doing that because they do know they want to get some results from it. And then there's another group out in California called Smart Patients. And that group is working first from patients back to research to show that there is this bridge of trust and confidentiality that get the data used appropriately throughout the research system. So that's the way I would look at it.
It's been a pleasure talking with both of you this afternoon. Thank you both for coming in.
Oh, Neal, thank you. It's been a pleasure for us, too.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio this afternoon with Dr. Bradford Hesse and David Ahern, both of which with the National Cancer Institute and authors of the book Oncology Informatics, Using Health Information Technology to Improve Processes and Outcomes in Cancer. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.